Knock, knock.
Hi.
Hi, how are you?
I'm well. How are you?
Good. My name's Natalie.
Rizwan Armstrong.
It's nice to meet you, sir.
Thank you.
I'm going to just take a seat here and chat with you a little bit.
You bet.
I'm a nurse here in the clinic.
Okay.
I see that you're here today to follow up for a recent admission you had to the hospital for congestive heart failure. Is that correct?
Yes.
Very good. Well, I'm glad to see you in here today, and I'm glad to see you look like you're doing better.
I am.
Good. Can you tell me a little bit about what brought you into the hospital last week?
Sure. So I woke up and I guess I had been feeling kind of generally unwell. But I started noticing shortness of breath, followed by soreness in my legs, and swelling.
Oh, I'm sorry to hear that. That doesn't sound very fun.
Yeah.
So while you were hospitalized, they see that they ran a couple tests on you, and that they indeed did diagnose you with congestive heart failure.
Yeah.
So I know you've had a little bit of education about that, and we're here today to talk a little bit more about it and then answer any questions you may have along the way.
Sure.
With the shortness of breath you were experiencing, were you having it with activity? Were you having it all the time? Was it when you laid down?
All the time.
All the time?
Yeah.
Didn't matter if you were sitting up, laying down, moving.
Right.
Just kind of experiencing it all the time.
Right.
Oh, I'm sorry to hear that. One of the medications that the doctors at the hospital started you on was called DOCC, which is something that we'll talk a little bit about today. In addition to when the doctor comes in, he'll talk to you a little bit more about it as well. But it kind of helps remove some of the excess fluid that you may have been feeling in your, or may have in your body, which can often cause the issues with the shortness of breath, or even the swelling in your legs. So, and we'll kind of talk about that as we kind of go on today.
Sure.
So I'm going to kind of start by doing a full assessment on you, and checking you out. And then after I do my full assessment, I'll just have some questions to ask you.
That's fine.
Just so we can kind of get a good whole picture of who you are, and that way we make sure we're treating you as a whole and not just the parts.
Yeah, I appreciate it.
Absolutely.
So what should we start with?
So we'll start with a kind of a general assessment on you, which is me kind of just what I'm seeing here with you today.
Okay.
So you appear that you don't appear to be in distress or having any anxiety with those.
No.
Is that assessment correct?
That is correct.
Great. I'm glad to hear that. Another thing, looking at you, which I know you got talked about with a little bit when you got discharged from the hospital with maintaining a daily weight.
Yes.
We weighed you when you came into the office today.
Yes.
And then I know that they gave you a log to keep track of your daily weights.
They did.
Do you have that log with you?
I do.
Thank you very much. I appreciate it. Excellent. So it looks like your weight today is roughly what you've been at home all week. So that's excellent. We love seeing that. And part of that is probably getting you started on that Lasix to help with your fluid status. In addition to just kind of talking a little bit more about daily weights. If you notice that you gain 1 to 2 pounds in a 24-hour period, or if you're gaining, roughly 4 to 5 pounds in a week, definitely give us a call.
Sure.
That can indicate that you're starting to have a little bit of fluid backup and retention of fluid, which is not an uncommon thing that can happen with congestive heart failure. Right. But by being proactive and giving us a call, we're able to help you. We might make medication adjustments or give you other suggestions. That will help to get that fluid so that you're hopefully feeling a little bit better. Because in congestive heart failure, your heart doesn't pump as effectively as it once did. And so that can cause it so that a part of your heart has an issue getting filled as quickly as it normally would, which can cause a backup into the rest of your body. And there's two different sides of your heart, your right side and your left side. And depending on what side you're having a little bit of failure on, can depend on kind of some of the symptoms you see. You and some people have a little bit of failure on both sides, and it just is kind of, it depends on each patient. So in your case, you have a little bit of heart failure on each side. So we kind of we have a large array of symptoms that we'll kind of look at, which we can talk a little bit more about those later. So, so now starting into kind of your neurological system, we always like to make sure everybody is oriented and not confused or anything. So can you tell me your full name?
Sure, it's Rizwan Armstrong.
Great. And when's your birthday?
01/07/1953.
Great. And can you tell me the current year?
2017.
Excellent. And what city are you in right now?
Portland, Oregon.
Great. And can you tell me who the current president is?
Donald Trump.
Very good. Have you noticed any confusion or anything of recent?
No.
How about when you were having your episode, when you were having that shortness of breath? Any confusion with that?
Yes, I definitely was confused about what was going on.
Perfect. And that's not uncommon, especially having so much happening and not feeling well.
Mm-hmm.
In addition to a lot of the times with the shortness of breath, you can have issues with getting good adequate oxygenation.
Mm-hmm.
And so you might not have enough oxygen going up to your brain, which can lead to a little bit of confusion as well.
Sure.
And I see when you were admitted to the hospital, you did have a lower oxygen saturation than what you would normally would have. Today you're sitting at 96%, which is beautiful. That's right. It's great.
Great.
And when you came into the hospital, you were at 85%. So definitely you could see that you were having some issues breathing, and it's not uncommon to have a little bit of confusion there. So another thing I'm going to check is your strength. Make sure all of your strength's intact. Can you give me hands a good squeeze?
Okay.
Great. Do you feel like the movement of your arms? Can you hold them up?
Yeah.
Excellent. Looks like you have good strength there.
I do.
We'll do the same thing in your lower extremities here.
Okay.
I'm going to have you lift your legs up and hold them for me.
Okay.
Great. And can you push on my hands like you're driving a car? Great. And can you pull your toes towards your nose? Great.
Okay.
Very good. All of that seems to be in order.
Okay.
I'm also going to take a quick look at your pupils with a little pen light. We like to just check for pupil regularity and to make sure they're equal.
Sure.
So I'm going to just take a quick peek. Great. Great. Perfect. Sorry for that bright light going in your eyes.
No, that's
there.
okay. I understand.
Yeah, but your pupils are nice and equal.
Good.
Great.
Great.
Excellent. Next I'm going to move into talking a little bit about your heart.
Okay.
I'm going to take a quick listen to your heart. And
Okay.
while I'm listening, I'm going to listen to your lungs and your stomach as well.
Okay.
And we'll talk about those systems as we kind of continue through your body here.
Sure.
Great. I'm going to listen to your backside for your lungs. Great. And I'm going to just sneak here and listen to your stomach. Perfect. Thank you very much. I appreciate it.
Sure.
So, talking about your heart.
Okay.
Have you had any chest pain or anything like that?
No, not since.
Great. Have you noticed any fluid buildup again? Like any edema in your legs? Any swelling in your legs? Have you noticed the veins in your neck sticking out at all?
No, I haven't.
Great. Good. So those are all kind of things that you might want to be on the lookout for as you continue. Sometimes you might have some swelling in your legs. You may end up having a little bit of you might notice a vein in your neck starting to pop out a little bit. It's called we call it jugular vein distension.
Sure.
And sometimes that can happen.
Mm-hmm.
And that just means that you have fluid building back up again, and that it's causing that vein to pop out. So
Sure.
definitely give us a call if you see that.
Sorry about my dogs. Just ignore them there.
Yes.
Yeah,
They're very cute.
Thank you. Anyway, so you called it
jugular vein distension.
But okay.
So that's just something to kind of keep an eye out. But mostly it's you don't need to even worry about keeping track of the name. But if you start to see the veins here start to swell up.
Okay.
Yeah. I'm going to take a feel to your legs here.
Sure.
I'm feeling for edema as I push along here. And it feels like you just have just a trace amount. Do you feel like it's better than it was
yes,
when you were
absolutely.
admitted to the hospital?
Yes.
Great. Yeah, I see from the chart that we put it on a number system and they gave it about a 2+ and it was pitting. right now. And by pitting, when you stick your hands in,
it
leaves an indent.
indent.
Yeah. Which I'm not seeing that today. They're just very slightly swollen, so that's great. Your heart sound good. We had an electrocardiogram or an EKG prior to you coming into the office today, so I was just taking a look at that. It looks good. A lot of the times with heart failure, you can have like extra heart sounds or weird beats that can happen.
Sure.
I'm not seeing any of that on you today. When I listened to you, I didn't hear any extra heart sounds, so that's excellent.
Good.
I'm glad to hear you're not having any chest pain or
Sure.
anything like that.
So is there anything else you need to check physically?
Yes, there is.
Okay.
Sorry.
I'm sorry about the dogs.
I'm gonna start over.
Did I mess up?
Well, I just feel like you got annoyed